Okay, let's wait for my students. I think they are coming at this moment, and well, patience. I hope they can reach the class. It's not a long session. It's 8 p.m. So I must expect them. If they don't, okay. Hi, Belkin. As always, Belkin is here on time, and that's perfect. Hi, Belkin. How are you?
Hi, how are you?
Fine. I came running. I was with my kids and I didn't realize the time, and I said, oh my God, it's extremely late. So I came here running, and my hair, I think it's strange at this moment here in my home. So, but that's okay.
Yeah.
How was your day?
Tired.
Okay, that's not a very long session, not a very big class. So
Yeah.
I think we can do it. Yeah. We are in the 11th class from 16. 5 more and it's finished, all done. Okay. So Belkin, we are together. There are no your classmates. They are not getting into the session. Let's wait. Let's wait 3 minutes more.
I can hear you very well. Can you repeat it?
Yes, that I mean we are alone at this moment. Your classmates are not coming yet. Okay, Fabian, Ruth, that's okay. It's Fabi. I have connection disturbances.
Me too.
Yes. Hi, Ruth.
Hi, how are you?
Hi, Fabi. Fine, fine.
Hi.
Hi, Fabi. Let's wait a little bit for your classmates. We are only 4. Okay. Well, yeah, well, would you like to start now or prefer to wait for a little?
I don't know if you prefer to wait a little bit because we are only 5.
Session, maybe she has connection disturbances.
Yes, maybe. Well, I start too late because that I can't enter to the link.
Okay. Okay, give me a minute to prepare the presentation while it's ready. And okay, we are going to start in a minute, okay? Okay. Okay. Okay, go ahead. I'm sorry, no more time. Can you watch my screen? A yellow one.
Yes.
Or to start today, I can be to able for to be in the feedback.
I'm sorry, Belkin, I didn't understand you. Can you repeat, please?
Today, I can be with you in the feedback during the class.
Okay.
Okay, thanks for complaining.
Okay, don't worry. We have more pictures in this session, so I think there is no trouble, okay?
Thank you.
Okay. So let's go ahead. Try to finish on time. We have our class today. It's about, as I was telling you, treatment. In general, medical treatment, surgical treatment, and therapies, alternative therapies, or other kind of therapies, depending on the view we were talking, okay? Not a deep information because it's a lot of ways of getting it into interpretation. So the most important parts I consider important, I am showing in this session. The medical treatment, for example, well, going first to the meaning. Medical treatment means the management and care of a patient to combat disease or disorder. Medical treatment includes all treatment not otherwise excluded, using prescription medications or use a non-prescription drug at prescription strength, using wound closing devices such as surgical glue, sutures, and staples, using any devices with rigid stays or other systems designed to immobilize parts of the body, administration of oxygen to treat injury or illness. Well, oxygen has specific indications, okay? Exclusions from definition of medical treatment. Well, we have some exceptions, right? And the exclude items are observation or counseling, diagnostic procedures, and the first aid. About observation or counseling, visits to a physician or other licensed healthcare professional solely for observation or counseling. It's not a treatment, of course. If we not receive any instruction, any recipe, there's no treatment to consider at this moment. The diagnostic procedures, the conduct of diagnostic procedures such as X-rays or blood tests, including the administration of prescription medication used solely for diagnostic purposes. For example, eye drops to dilate pupils, they are not treatment. And first aid, of course, all the first actions we make to help a person, to help one that is in trouble in many situations. We know what is the meaning of first aid because all the career we talk about it. The classification of treatment, the most common one is the three branches: the curative, the palliative, and the preventative. The curative, to cure a patient of an illness or disease; the palliative, to relieve symptoms from an illness; and preventative, to avoid the onset of an illness. Okay, about the curative, of course, we know to administrate, to prescribe infusions, pills, I don't know, many drugs for giving a solution about the trouble. Okay. So we have many options, and we all know about it. Palliative, to relieve symptoms, specifically relieve pain. Okay, chronic situations such as cancer could be the best example talking about palliative treatment. And preventative, of course, avoid onset of an illness. For example, we have preventative treatment with tuberculosis when we have a contact and we start taking pills, the isoniazid, just for avoiding the infection time. Or maybe when we detect a case of rabia, I mean, we receive the vaccine, 14 vaccines, 14 shots in order to try to avoid the infection. So that's the preventative treatment. In that way, preventative medicine is the branch that educates people for avoiding medical situations, avoiding that kind of risks that can involve illness, diseases, accidents, and many situations. But preventative treatment help us to avoid the onset at the beginning of a situation that we know that maybe a contact could have. The vaccination program, specifically with the tetanus vaccine, the rabia vaccine, is a preventive treatment. Okay. We have to know that it's very important for us to know about prescription and drugs. The prescription is a part of a treatment, and a doctor may prescribe medication. Of course, we are prepared for doing it. We study pharmacology in order to do this action. Okay, and commonly to the commonly people we refer to as medicine or drugs. Okay, and prescription usually have these forms by handwriting in the old style, or actually it's printed or typewriting, but it's not by handwriting because of the mistakes usually could happen with these situations. So we have to consider that for a legal purpose, it's better for us to get it printed, okay? But for example, here in Bolivia, we still use the handwriting way. And we know that there sometimes we ask in our WhatsApp groups or with friends, can you please try to help me to understand what's the handwriting of the doctor? I cannot understand the meaning. And in a group, we are trying to find what he has prescribing, for example. So we all know that our handwriting is awful. So we have to try to improve it. In that way, it's better to use these ones. In the United States, United Kingdom, Europe, well, big countries, the first 4 countries, we use this, the printed one, not the handwriting way. For example, in the UK, patients take prescription to a chemist shop, like here, which sells a wide range of non-prescription medicines and other products such as cosmetics. In many countries, you can find cosmetics in chemists, okay? Not in every part of the, not everywhere, I mean. Not on the streets or maybe another kind of stores, just chemist shops, places that are prepared for having a good weather, a good place to get it in the right conditions, okay, for being safe. Okay, for dispensing of a pharmacist, the person who prepares the medicines. In hospitals, prescriptions are dispensed by the pharmacy, the department where the drugs are prepared. In the UK, you have this division: chemists on the streets and pharmacy in the hospital, okay? But in other parts of the world, like here in Bolivia and Central America, I don't know, we have drug stores all over the way on the streets too, and not the same as a chemist shop. So we have to consider this. That's just a different way of talking about, but the objective is the same. The medical recipe or the medical prescription, of course, has a way of being done, and it's the same in Spanish, in English, in Chinese. It doesn't matter the place. You have the same data, the same information to consider, and the same way to do it. So it's not a mystery how to do it, but we must remember that we have 8 parts to talk about: the prescriber information and signature. So how we are going to do it, who is doing the recipe, the prescription paper, the patient information, the date prescription when it was written or printed, the superscription holds the RX symbol, meaning take dot, you take, or recipe, we know it in Spanish too. The inscription is the medical prescribed, the medication we are giving to our patient. Subscription, the dispensing instruction to the pharmacist. It's not for the patient. The pharmacist is going to know how to get the correct interpretation of that information. The sign-up, the given direction or instructions to the patient, and the special instruction that is optional. Not always we need to do it, okay? So we have pictures for recognizing this situation, yeah. The parts of a prescription, the date, the name, age, and weight of the patient, the superscription, the inscription, subscription, the signature, well, the signature, the signer, how the patient is going to take it, signature, and any other details maybe. And we have one that is fulfilled. The data of the doctor is the top, name, and maybe the specialty or the medical doctor, and that's all. The legal number for working, the direction, the location for the consulting room. Okay, the phone number is very important data. Not always we use it, but it's a very important part of the recipe. The name of the patient, address of the patient, age and date when we are going to do it. Just for example, the medication, the sign, how the patient is supposed to take it, the refill, any other instructions. If we want the pharmacist, okay, for example, in UK and USA, we have here in this place the DOA and a special number of recipes of times that we expect that the pharmacist sell the medication to the patient, and we can handle by a circle that number. We can say 1, 2, 3, 4, or maybe 5 times, or just mark no more sell. And that's the situation. That's a part that the pharmacists feel. Well, the signature of the doctor, again, the legal number, okay? And of course, we have the common abbreviations we use for prescriptions and indications into the hospital. We know all of them. We were practicing with them. And of course, we can check. For example, AQ, the water, and aqua. All of these are based in the Latin language. I don't know why, but we still use it. And as I was telling you in the Model 1, Americans love to make this mess using English, Latin, and common words. So we have to understand, okay? Guta, GTT, drops, for example. Non-repetitor, no rip, do not repeat. Or PRN, prorenata, when necessary. We use this in Spanish a lot. The quartering die, 4 times daily, the quit. So we also have the bising die, twice a day, the bit. We use this, okay? So we know how to interpret it. We know the moment to do it. And of course, when we make it in English, we tell the patient, for example, in a recipe, signs, for example, in this, sign in rect, in the rectum, into the rectum, PRN pain. When she has pain as a necessary, when necessary, while during pain, while showing pain. That's the sign of the way that this doctor is giving this medication. Okay. Until this moment, any question maybe? Hello? I know I have few students, yeah. Any questions? If that's okay, we can go ahead, okay?
No, all it's okay.
All is okay at this moment. Thank you so much. So this abbreviation, please, we are going to study to practice with them. And the homework we have for tomorrow, please, use these abbreviations, okay, in your treatment, in the way you get the idea of showing me the treatment you are preparing for your patient, okay? I like to see this because it's a very common way of working, of talking, and we all know about it. We have the practice during the career, we learn it, and well, if there's a question, send me a message and we are going to practice, okay? For example, we have a very important difference from the American and the Latin American formulary, medical formulary, and we have to consider this. The British National Formulary provides information on prescribing and administering prescription drugs with more details, with more information as we consider in Latin America. They talk about side effects. They talk about in a very big way, the dose apply, and they use the commercial term and the chemistry name, okay, the chemical way of talking about the medicine. So they use this model for working on, and that's important for us to recognize that they give information written. They not just explain by talking, okay? They write the side effects, so maybe they also add the contraindications, okay? And for our vocabulary, we must remember that an indication is a situation or a site that suggest a specific treatment should be given. Okay, a contraindication is a situation or sign that a specific drug or treatment should not be used or is contraindicated. We have the commercial name. For example, Exelderm registered is the proprietary name for a medication containing sulconazole nitrate. The same drug may be both proprietary names and a generic name. So we have to get it clear. We have, for example, the Prozac, the commercial name, and the generic name, fluoxetine, okay? And that's the way in the United Kingdom and with some medication work in the USA, usually with controlled medication, okay? Not with all of the medications at the moment. For antibiotics, we must understand that in other countries we use both names. Here in Bolivia, because the law is for everybody, and in the public system healthcare, we use the generic name, just the generic name, with the public medicine. In the private medicine, we can use the commercial name and we can use the lab we want. It's very different from the rest of the countries, okay? So about the medical treatment, I think that's the most important part. I'm not considering many topics, for example, indications of oxygen, indications of fluids, because it's not an objective to talk about it. But if we consider it's necessary, we can try to get the time at the end of this module and have a class about it, just for remembering, for getting the vocabulary. But at this moment, it's not the objective, okay? The surgical treatment, of course, we must consider that it's not for everybody at first. We have specific indications for doing it, for receiving it, for being the bunny of the surgeon. Yeah. And well, we have to get a definition. It's a medical procedure involving an incision with instruments performed to repair damage or arrest disease in a living body. Okay? So the objective, we know, it's to cure, to solve a problem, and to get an objection open in the body. We know it. The surgery is an invasive technique with the fundamental principle of physical intervention on organ or organs, systems, or tissues for diagnostic or therapeutic reasons, not just because of practice. We have to get in a supported way, supported information that show us that it's a necessary procedure to make, to be involved with that, okay? As a general rule, a procedure is considered surgical when it involves cutting of a person's tissues or closure of a previously sustained wound, okay? As I was telling you, it's not for everybody. We all know the indications of a surgical treatment. We all know the situations and we know how it's been performed. Very trained personnel, very trained doctors just do it. And depending on the situation is different for everybody, okay? The operating theater, we all have the experience for being one into this theater, of course, and it's called theater because of the history while we were talking about. For example, at the beginning of the surgical procedures, we might consider that was a very huge space as a theater. That was the same disposition of the banks, and in the middle of the place were so many lights, natural lights, of course, not like the modern ones, not artificial lights, white ones. There were the natural lights, and all of the people was watching around and talking around and trying to understand and to learn from the surgeon works, okay, from the surgeon procedures, not with the antiseptic situations we have. A theater could be fulfilled with 100 people expecting how the surgeon makes his job. But now at this moment, we know that, of course, we have a very reduced team, just the ones that have to stay into the operation room, okay? That's why surgery is carried out in an operating theater. The theater is because of the history. The great care is taken to make sure that the operation takes place in sterile conditions where is the less possibility of getting infected, the less possibility of getting a bacteria, a potential bacteria for killing us. Okay, that's why free for microorganisms. The surgeon and his or her assistant wash up or scrub up and put on surgical gowns, masks, and gloves. The patient's skin is prepared by disinfecting with an antiseptic solution. And this is known as prepping or preparing the patient. The prepping is the correct expression for this action. They are then covered with sterile wraps, not only the area of the operation is exposed. We know we protect all the skin, we try to avoid the microbiota from the skin, and then we try to get the sterile conditions for having a safe procedure, a sterile procedure, okay? And we have an example of our clothing: the surgical cap, the surgical mask, the surgical gown, the gloves, and the surgical shoe cover. The scrub is under all of this gown, okay? That's two pieces of being in word, in shift, and that's the scrub, okay? And of course we have instruments, lots of instruments, but of course we know the basic ones, the most important ones, the most common ones, of course, and we all learn how to use them, how to catch them. For example, the plain thumb forceps without teeth, the rat tooth, the thumb tissue forceps. We can see the difference between the plain thumb and the rat tooth. Just the objective of each one is different, of course, and we know it. The curved mosquito hemostat used to hold delicate tissue, used to compress bleeding vessels. Jaws are fully serrated. You can see this, full of serrated pieces, okay? Just for having the correct way to hold the tissue without breaking it. The cryohemostatic forces, we know it, again, full serrated and could be bent, could be curved, could be plain, that's okay. The Kocher, or in other places, Oshner, hemostatic forceps, okay, again, we did. The needle holder, we all, I think, used one of these, used to hold and pass suturing needle through the tissue, and has groove to hold needle within jaws, so we know about it, okay? This is the groove, this line that is going into the serrated into the serrated jaws, okay? This is the group, this line, just for helping to catch the needle, we know it. The Mayo-Higar needle holders, it's different from the common one because of the length, that's all. The towel clamp used for catching well, adding weight to the drops and towels to ensure they stay in place for not moving the surgical weight, the surgical drops. And allow exposure to the operative side. We know it must be open, that's why we can for getting the correct vision of the structure. The Alice tissue forceps, we have the difference here in this part. The Alice is a very common and very useful piece. The backhouse towel clamps, again, we use this for catching muscles specifically. And sometimes we can see these backhouse towel clamps making the towel clamp function just for improvising and saving the moment, okay? Well, we have the scalpel holder, of course, we know it. holds the scalpel blade and acts as a handle. It helps us to catch and move the scalpel in the correct way and make the correct movements. We know about it, we know how to work with it. The sharp scissors used to cut and dissect tissue. Both blade tips are sharp, both of them have the same objective, but we have to consider how we place it to get the correct cut. The Mayo dissecting scissor on the top, this one, and the medicine ball scissor, this one. You see the difference because of the length, because one is white and the other one not. And the scissor, this piece, this specific place is bigger than this one. The curved blunt or blunt scissors, we know them. Both blade strips are blunt, can be curved or straight, it depends. We have suture scissors, blunt, just for sutures, not for other extractors. Don't kill this scissor, please. Again, sharp blunt scissors to cut and insist fascial muscle, one blunt tip and one sharp tip. And the Lister bandage scissors with this point that is helping us to protect the skin, used to remove bandages and dressings. Probe tip is blunt, inserted under bandages with relative safety. So we must have the practice to do it without cutting our patient. It could happen. We have in general the parts of the surgical piece or a surgical instrument, and how to catch the scissors, how to catch this surgical device, okay? So we have the idea, the general idea about it. Now we have retracting and exposing instruments. Of course, they're very common into the surgical theater, the surgical room. And we use all of them to open the wound and get a correct vision of the situation to have to correct it. So that's the way we can work with it. The self-retained or manual, held by hand. I think all of us in a moment of the medical school where they're retaining material, catching the wound with a retracting instrument and with the surgeon doing everything. When identifying retractors, look at the blade, not the handle. So with this instructor, you know the use for everyone. The deeper, the retractor manual, is used to retract deep abdominal or chest incisions, available in various ways. It's flexible usually, and you can move it and prepare it, and you can put it in the place you certainly need it. The Belfour abdominal retractor with blade, this blade, it opens. You get here to be catched, I mean, for not getting closed, and then you can adjust the blade. And it's very helpful because you don't have to be, as a student, catching the retracting instruments, okay? This is for abdomen, the Belfour bladder. Well, both of them are the same. It's closed, it's open, and that's okay. And now we get the operation movement, the top of the time that we are expecting, okay? We have the operation begins when the surgeon makes an incision or cut. Control of bleeding is very important, and a swab is a pad of cotton or other material used to soak out blood from the operate site. A sucker is a mechanical device which aspirates, sucks up blood. We all know this one. Bleeding vessels are tied with ligatures or sealed by an electric current, the diathermy. Okay, we all know this vocabulary, just need to practice with them. And we have drains, this piece. The drains may be inserted to carry away fluid which might as a culture medium for bacteria. Various methods are used to close the wound, for example, sutures, also known as stitches or staples. Finally, the wound is covered with a dressing. This white one is the dressing wound, okay? So we must consider this vocabulary just for remembering, for practicing, for getting more ideas about talking, okay? And we have an example of an operation report, how we receive that information, okay? So in that way, we must remember just how to talk about it. This patient had an indirect right inguinal hernia. That's the diagnosis for getting to the operation. Anesthesia, spinal anesthetic with local anesthetic, infiltration. Incision, right inguinal. And the procedure, all the description, okay? The external oblique aponeurosis was divided and the spermatic cord mobilized. The hernial sac was identified and separated from the spermatic cord, and the hernial sac was then mobilized back to its neck where it was transfixed, and the redundant tissue was excised. The fascia and the neck of the spermatic cord was divided carefully, preserving the vessels. The genital branch of the nerve and the vas deferens cord was divided carefully, vas deferens, yeah. Thereafter, the posterior wall of the inguinal canal was repaired into layers. So we check the vocabulary we use, and it's a very technical one for getting it as a resume and the most important ways we were doing it, and considering the anatomical exceptions like the redundant tissue and the procedure we performed, okay, the exist redundant tissue. About the closure, the wound was closed in layers with Dexon suture material to the external oblique aponeurosis and staples to the skin. I think it's a very general paragraph for understanding the most important vocabulary and getting the idea of what we are talking about. About another kind of therapies, we must consider radiotherapy and chemotherapy. Just a general view of them, because we don't have enough time, I mean, for talking about it and getting all the variants, all the branches we can talk about it, because it's a very, very, very huge explanation. And well, the most important topics are the ones that I'm considering this moment. Okay, the radiotherapy is the use of radiation in a controlled doses to treat cancers. It works by damaging the DNA of malignant cells. The radiotherapy may be used as curative treatment, for example, to shrink tumors, as adjuvant treatment alongside or following chemotherapy treatment with anti-cancer drugs. In lower doses as palliative treatment to reduce pain and other symptoms of cancer disease, but not as a cure. I mean, just palliative to control the situation, but not curing, because we know there are terminal situations, right? Of course, this radiotherapy is performed by the radiologist. The radiologist determines the dose and the exact target for the radiation beams. Dosage is measured in grays, okay, the GY. A daily dose is a fraction, just a fraction of the total dosage. It must be done to the patient, okay? The radiotherapy can also be delivered internally by radioactive implants, such as needles, or by liquids such as strontium or some bone cancers, okay? We have an extra way for working with the radiologist, and it's with seats. these structures that are implanted into the skin and the tissues and have a radioactive source. It's for a long-term treatment and usually for being palliative, not curative, just for palliative because of the pain, okay? How does radiotherapy work? The external beam radiotherapy, we know it. The brachytherapy, we know it. We introduce the device, in this case, the bronchoscope. We use the radioactive source just into the tumor, then we froze this, and then we take it away. Another kind of therapy that is very useful, very common, and very important is the physiotherapist job, the physio. The physiotherapy, of course, helps us to recover from many situations. We were talking about them in the first and the second presentation from the model 1, and we must consider them as a very important part of our work, of our job. And we might understand that without them, we cannot do a correct job, a correct control, and we cannot help our patients to get the correct recovery. As a doctors, we say, my patient needs physiotherapy. Okay, but we send the patient we refer the patient to our professional allied to do this specific kind of activities. Taking this example, we must understand this situation, how they work. Sam, our girl, is a hospital physiotherapist. She works mainly with patients who have conditions or injuries affecting her lower extremities, such as fractures, torn ligaments, and cartilage tears. Most of her patients are referrals from other departments in her hospital. Usually, we all refer our patients, not most of them. She also works with patients in rehabilitation following orthopedic surgery. We know indications for orthopedic surgery. Some are young people with sports injuries, very common ones. Others are elderly people who have had hip replacements. We know these indications. Among her therapies are manipulation, massage, and exercise to keep the joints mobile and to strengthen muscles. Rehabilitating some patients means helping them to walk again using crutches or Zimmer frames. So we can understand this. This professional, of course, is important for us in order to get all the corrections we need, all the situations we can do it. Okay, we can do at this moment. And it's a very, very important way to do, not to understand how we can work with them and then control our patients correctly under the full recovery time. Okay, and that's why we have to work on this. So the crutches are this. We have these ones that are comfortable, I think, and we have classic models, yeah. And we have the Zimmer frames, in Spanish, the burritos, yeah. So we can understand how they use these devices for helping people to walk again. Okay. And of course, we have another branch, another professional allied to us, the psychologist, for helping us to develop the cognitive behavioral therapy. It's not a very strange situation nowadays to know that some of us, or maybe we, are in therapy for understanding and trying to solve our own problems or own disturbances. The cognitive behavioral therapy, the abbreviation CBT, is one of the talking therapies for mental health conditions. It aims to eliminate negative thoughts and change behavior in response to these thoughts. It can help with anxiety, panic attacks, depressive disorders, post-traumatic stress disorder, and chronic fatigue. Therapy can be provided face-to-face sessions. With a therapist, it's the best one, but delivery by computer can also be effective, the online session one. It's not the most recommended, but sometimes it's the alternative we have for our patients. It's more effective than counseling from some and can provide long-term protection against relapse. If we start therapy, it's better to finish it no matter the time it takes. And we have to consider it for our patients while talking to them and explaining the importance for going to psychological treatment, I mean, or that kind of specific behavioral therapy, because it's important for them to understand all of these situations. Anxiety is not a comfortable way of living. So when we identify a patient with that disorder, we must try to help this one, sending them to the cognitive behavioral therapy. And as a doctors, we can see if it's working or not. And if we have the doubts, we can talk with the psychologist, and then we can realize the situation of our patient. Okay, against relapse, I mean a return of symptom of improvement. However, patients must be committed to solving their problems and prepared to work on them between sessions. So it usually happens that you go to a session, talk to your therapist, change opinions between your therapist and you. And while finishing, the therapist gives you some homework, some tasks to do during the whole week or the whole time you are going to stay home. And with that results, you have to go back. Usually you handwrite all the tasks, all the things that the therapist was asking for you to do. And with that handwriting terms, you go to the therapist, and then you couple check all of this, and then you can watch and you can realize what is going wrong with you. And then you can take the correct idea about doing any other activities maybe, or changing your routine. It's so helpful. I mean, during the medical school, I was in therapy for around 2 years because it was so stressing time. And when my professors checked the way I was working with the chronic fatigue, the stress of being in a different country, different culture specifically, they said that you must go to therapy and that's all, you don't have no choice. And they sent to me, and that was so helpful for understanding all the situations I was living in that moment. So that's not an embarrassing situation. We have to try to avoid in our societies that going to therapy is being crazy. It's not the real way of thinking, I mean. And I think if we have the opportunity of helping one, why not? Okay. And of course, we have our final phrase. If you have choices, choose the best. If you have no choice, do your best. Okay. I think it's clear. Talking about treatment, talking about medical knowledge, sometimes we have to try to make the best choice for our patients. And sometimes we have no choices for them, or maybe for us. And that's why we must do our best, right? So, I mean, any question at this moment, maybe? It was not a long presentation because treatment, as I was telling you, is a very general view. But tomorrow in the workshop, we are going to have some topics to consider, like indications for the patients we are working on. Maybe a question about it. Something you would like to check again?
No, it's all clear.
Everything
for me.
clear, I think, okay? Fabi, everything was clear for you, Fabiola?
Yes, everything was clear.
Yes, as a general view, it's okay, because the objective of giving indications, for example, it's not at this moment. Not in this topic, because when we were talking about the clinical history and how to write down indications, prescription for a clinical history, of course, is different from an out indication, a recipe. Of course, they are not the same. And recipes are very important part for doing in a correct way, for writing down all of them. It has requirements that not always we consider as necessary. And we can see many mistakes in ours, and the first ones we are writing down, because we don't consider these requirements, these 8 points. And if you think about it, in Spanish, in English, they are the same, just the same. So we, just for remembering, for practicing, we have here the order, but maybe we have to consider we get it inferred during pharmacology, not as a topic about how to write a medical prescription. For example, I never received that class, and I said, why not remember this? And I found lots of information about it, and I found many examples about mistakes that we usually make, but it's not an objective to show it. Okay, so for the homework for tomorrow, any question you have, any question you would like to be clear to, I don't know, something is difficult, something is not clear, something, I don't know, anything to talk about it. Hello.
No, teacher, everything is clear.
It's clear, easy to make, right?
Yes.
Okay, so tomorrow I expect your cases until 5 p.m., 2 hours before the workshop, please, for letting me preparing all the material I'm expecting to show, but I need your homework to do it. Okay, 2 hours before the workshop is the deadline for receiving the homework.
Okay.
Okay, so let me send the diary pool for assistance. It's open. I think we can finish on time. Can you see that? Okay. All of you, John Harold, can you listen to me?
Yes, teacher.
Yes. Okay, thank you. Did you feel the pool, right?
Yes, teacher.
Well,
I can see that pool, teacher.
you cannot see it. Okay, let me relaunch it again. And let's try to correct it. Okay, Belkin?
Okay.
Okay, now at this moment,
Not yet.
not yet. Okay. Okay, Johan, can you watch the pool? Yesterday we had little troubles with this. Well, Johan is out. Agar, can you watch the pool maybe? Could you feel it? Agar. Well, there's no problem. Okay, I'm going to send it again. Okay, Belkin.
Okay.
Now, can you watch it?
No.
Hmm. Okay. How many people we are?
Miss,
Hi, Johan.
did you ask for me? Did you tell me something?
Yes, I was asking you about the diary pool because yesterday we were having trouble about filling it.
Oh, okay. No, yes, I did it.
Okay, you did it.
Thank you.
Okay. At this moment, Belkin is having trouble with connection. So Belkin, did you watch it? Did you receive the poll?
No.
Okay. Okay. Okay, people. Belkin, can you stay into the class maybe for a few minutes? I'm trying to correct it. Rest of the people
Okay.
can, and the rest of the people can go home. Can go for studying. While finishing, I'm going to send this small presentation. Yeah. Okay.
Yes, thank you. See you tomorrow.
Okay, see you tomorrow. Please prepare homework with your job. I'm going to work. If you don't do homework, you don't finish it, we cannot do anything tomorrow. Okay?
Okay.
Okay, thank you.
Okay, bye everybody.
Bye.
Okay, Belkin, let's try to correct this.
Okay. Teacher, yesterday in the workshop, we were
Yeah.
talking about the link in the website for to know more about
The
the
treatment. Yesterday, I'm sorry, I completely forgot about it. Let me send you by WhatsApp the article I was telling you.
yeah.
I'm sorry, please
No, there is no
don't hate
problem.
me. Yeah, don't hate me.
No, no, I can't do that.
I certainly forget it. I'm out of mind.
No, I know yesterday was a hard day for you.
Yeah, well, all of the days are getting so difficult at this moment. I don't know what's
Well, is
happening.
the medical life?
Yes, but with my kids, I mean,
Yeah, it's
they
not easy.
are growing up and they need more attention. They are asking for more attention, and I just say, okay, yeah,
They need to hear mom.
yes. They need more time with me, and I am out of time. It's not easy for them to understand my routine.
Yeah,
Mm. Even though our lifestyle is so hard. Yes, this was...
yes. It's not easy for to comprehend the medical life.
No. Okay, I'm sending you the message, the article by WhatsApp.
Okay, thank you.
It's about hypertension. No, but I sent you twice, okay? About diabetes and hypertension. I catch the couple, yeah.
If you had one more that talking about the medical report, that will be amazing for to study more about that.
About the medical report, exactly what
Yeah,
point do you need?
all the points.
Okay, let me check the information because there's a lot of information to check about it, okay?
Okay.
Okay, let's try again. I relaunched the pool. Can you watch it?
No.
What's happening?
The
You are on
problem
your
is
cell phone?
today I'm connected, yeah, in my cell phone,
Okay,
not in my computer.
Okay, let me check. I'm getting to the Zoom session with my cell phone too. And let's try to find the place. We have, okay. We have 3 dots, okay, in the right bottom, the right corner, okay?
Okay.
Try to open it and they said pool, or in Spanish, votación, yeah. And in that place, it's opening in my cell phone because it doesn't open to the screen.
I'm looking for that.
You have the audio, the video, the green button of sharing, participants, and then the 3 dots with more. You
Yeah,
open,
I'm here.
yeah,
Chat.
yes. Chat, meeting configuration, raising hand, and there must be votation or pool.
No, there is no appear here. Let me check in configuration.
There's not the option.
No, there is the option.
Yesterday with Agar, we had the same trouble with about the situation. And well, she could watch the diary pool, but she couldn't mark the option.
No.
Finally, she sent to me a message to the Zoom chat giving her points from the 3 questions. And
okay, I will do that too.
Yes, and I sent the picture to the academical superior because it's out of our hands, the situation, maybe connection disturbances.
I think that too,
Yes.
because today I'm connected on my phone.
Yes, here in Bolivia, all the day we were having connecting disturbances. And well, at this moment, it's not easy to correct them because here it's raining, it's so cold, and with that weather, internet connection gets terrible.
Yeah, I have trouble today because there were a problem with the electrical, I think, service.
Okay.
The first point was muy preparada. Really?
Okay, ¿qué tan preparada estuvo la clase hoy? Is the question. Muy bien preparada, algo preparada, no estuvo preparada o no me gustó. Yeah, it's in Spanish.
The second one?
Okay, bien preparada. Okay, please write down in the Zoom chat for showing
I'm writing right now.
Okay, perfect.
I forgot the number 3.
Number 2,
2.
¿entendiste el contenido avanzado hoy? Totalmente. Sí, más o menos, no.
The number 3, ninguno. Yeah. I sent you.
Okay, perfect.
Chat.
Thank you so much. Give me a minute,
Okay.
please. Don't leave the session at this moment.
Okay.
For taking the picture, the screenshot or the picture that you are in the class. Yeah. because
You
it's
need
out
I
of
turn
our-
on my video just for a moment?
Yes, please turn it on. Yes, a smile. Yeah, a big smile. We made the same with Agar yesterday because we didn't have an option to correct it. Okay, thank you so much.
Okay.
It's clear and
Thank
it's
you.
possible to read. Give me a moment. I'm going to take one more with your name. It's not a good situation. Yesterday was fun with Agar taking these pictures. And she said, what you are doing, teacher?
No, and
Taking the proof you were in class. Of course,
the
assistance
worst
is,
part, if today I look very tired.
nah, don't worry. We are doctors, don't forget it. Okay, that's perfect. Thank you so much, Belkin. So I'm going to send
Bye-bye.
it to the superior and there's no trouble, okay?
Okay, bye-bye. Have a good
Okay.
night.
Bye, you too. Have a good night.
Bye-bye.
Bye. So we finished this short session. I hope all of them could be in this way. And that's all. Tomorrow is going to be a hard day because of the workshop.